So Ted asked me, he said, Dave, you believe in the freedom of this country, the freedom of religion, the freedom of press, freedom of speech, don't you? I said, yes. He said, great, because I'd like you to speak for free. So this is how we got there. But I think I'm also speaking to the converted. I imagine that most people here are fairly, how many here are advocates of medical cannabis, first of all? Sure. How many are advocates of legalization and decriminalization?
No. Legalize it.
Yeah. How many are just here for a free joint somewhere today? Probably. I want also to say, well, doctors are back. How much I appreciate this lecture before me. I feel like a buffoon now getting up here trying to, I can throw out half my time. Thanks very much, you saved me. But that was fantastic, and I do appreciate that very much. First of all, why me? And I guess it's because I'm in the media that Ted asked me, and I did win that Pulitzer Prize for my autobiography, Life as a Repeat Nobel Laureate, which I co-wrote with Mayor Rob Ford and Lindsay Lohan. And so, as a result, I'm here. But I think it's all about perspective. Now, I'm going to start by telling you who I am and why this is perhaps more poignant than somebody else's case here. Is that I'm a very conservative individual. My friends say I make Harper look like a hippie. That's how conservative I am. I was raised as a Mormon, as an LDS church, and as such I went on a mission, did all the things, got married, have father of 2 wonderful children, and one other. I went ahead and have since not been what you would call an active Mormon by any stretch of imagination, but I also, being conservative, I've never drank, I don't smoke, I've never done cannabis, and I know that these are some major flaws that I have to overcome, and I'm trying to lose those by joining AA, which is Abstainers Anonymous. But I began to learn about these things, and I honestly believe in truth, and which is why I've sort of arrived at this place in my life. I went to a little island in the South Pacific called Tana. Now, it's one of those myriad dots of islands that you see when you look at the map of the South Pacific, and it is a part of an archipelago of about 90 islands in the country of Vanuatu. Those of you that are seen Survivor may have heard of this. And it's a jungle. And the island of Tana is, you would consider extremely uncivilized, extremely unsophisticated and poor, and without. It is replete with typhoid and TB, malaria. And there are about 30,000 people on this island who live much the same way they did 30,000 years ago. I was the only white man that many people had ever seen on this island. Go to the villages and children would come out and go, Lord, Lord. And those are very big shoes to fill, I said, back away. But irrespective is, I learned, well, first of all, oddly enough, Vanuatu, the last 3 years, has been named by Lonely Planet as the happiest place on earth. This place that is rampant disease, that has no paved roads, no electricity, no money. They live a very subsistence agrarian society, and yet I got to live there for about a year and got to learn why they became the happiest people. One of the things I did learn, it's not related to that, but is the fact that I learned the power of leaf medicine, because they use leaf medicine for many things, and I saw this work. And I was astounded to see it do the sort of things, which I won't get into the details of them, but it was certainly a lesson to me. And so that was one thing, is that I began to realize that there were more than just the big pharma, farm versus pharma. I also, let's say 8 or 9 years ago, had a woman come into my office. She was in their 80s, early 80s, and she had cancer. And she said to me, I take medical cannabis, it's the only thing that works for the nausea of my chemotherapy. And my son, who's a doctor in Ontario, recommended it for me. Now, could you make it legal? I don't want to be a criminal. I've never jaywalked. And it kind of struck me, and I think any doctor who's honest will know that they have many patients who will say that the only thing that works is I borrowed some of my friend's cannabis and just happened to use it, and boy, oh boy, did this ever help? Did this ever help? Did this ever help? And so I began to listen to them. I think it's important that we listen to patients to find out what's really happening. And I began to listen more and more. And I think, as I say, it's more important to unlearn than to learn very often. And I have been unlearning my whole life. and continue to unlearn as I learn more. But I really believe that we are at a tipping point in the world of medicine when it comes to this. Just this week I sat down with a whole group of physicians and talked to them about what my experience and knowledge is of medical cannabis, which is just this much compared to Dr. McKinney's. But it's still, I can tell you that by the end of this meeting of an hour, 100% of the doctors were in agreement with me, which was remarkable to see that there is this tipping point. These physicians are not callous. And I'll tell you some of the reasons why they may be hesitant. I think we'll come up to that in a minute here. But just this morning, it was like I was supposed to be coming in here today, because honestly, I worked this morning at the clinic. I opened up a clinic for people who can't see me during the week from 9 till 1. And so this morning a patient comes in, no idea I was coming down here, and she brought me this, and she said, "This is for you." And she said, "And this also, I'm going to loan you because I know you're trying to learn about this." And she said, "By the way, in there is my very first purple kush leaf." So I'm very nervous now. I'm looking around. You're giving me this stuff. And anyways, this makes my briefcase smell wonderful. But it's this is happening. And then I had another patient, and this is not a word of a lie. She's in her 70s. Her sons had, she was, obviously no names, but she was a professor at McGill University. Again, never did anything wrong. Her husband was also a professor in his 70s. Bad problems with irritable bowel, migraines, and anxiety, had been on different things. So finally I made the move to switch her over to some medical cannabis. Tried different preparations with her. And her sons and her husband said they've never seen her happier in 20 years. And I thought, and her bowels are settled down, which I'm sure you're all pleased to know. Her migraines are gone, which is fascinating because William Osler, who's a name that every physician knows as the modern founder of medicine, has written extensively about migraines and cannabis, which is remarkable for doctors to know about, because doctors back pre-1937 knew much more about medical cannabis than doctors today, because we have our instruction, a lot of it from pharmaceutical industries, who have no interest necessarily in medical cannabis becoming front and center and going through studies, and there's no financing because of that. But this was just this morning. Anyway, her sons are just, they are sort of remarkable people, actually very famous musicians, one of them is, and they just love the way that their mom has been, and she is just elated. All of these things have settled down for her, and it made me think, if the worst side effect of this is that you feel good, is that bad? You know, and of course as we begin to realize, with all the fact that every 19 minutes somebody in North America dies from a prescription overdose, or malprescription, nobody dies from this. We're starting to get the message. We're resilient. We are have a hard time unlearning, but we are. And I think it's happening. I really honestly believe that. Now, I had another patient many years ago come in, and the very first time he came to see me, he'd read some of the nonsense articles I write, and he came in and I opened the door, and he's lying on the bed with his feet up in the stairs. And his jeans on, a big rip in his jeans. And I looked at him and so, who are you? And he introduced himself and says, I figured you would appreciate this. And I haven't, we've become friends, and but he is one of these well-known conspiracy theorists. You know, to say he's a conspiracy theorist is like saying, you know, my dog needs a breath mint, which is both true. And I've learned from him things like JFK was actually killed by a gay whale named Frank. And these are things he's teaching me as we go along. That Tim Hortons is founded by Pfizer and Mother Teresa. He's got so many of these theories going on. But he's also one of these mavens. He knows a lot about a lot of different things. And he said to me one day, he said, did you realize that medical cannabis was made illegal because alcohol was made legal? Yeah. I thought, well, that's conspiracy. But I actually went and read about it, and I began to learn more about it, and became familiar with the 1930s and the Harry Anslingers, the bigoted toady of a Federal Bureau of Narcotic head, and the corruption of the Hearsts and the DuPonts and the Mellons and all the things that went on by there. I was fascinated by this history, and it made my head spin to realize that we have just been party to this over the years. And I've begun to rethink all of this as time goes on. In 1914, the Harrison Act that separated recreational drug use from medical drug use was so resisted by physicians that 25,000 doctors subsequent to that act were arrested, and 3,000 did time in jail, prison, doctors did. And I wonder, where is that courage today, doctors standing up against it? I know in 1937 with the Marijuana Tax Act, that I'm sure you've heard a bit about, that made, virtually started to make marijuana more illegal. But the lone voice that stood up against that proposition from Anslinger was the American Medical Association. Because they knew that there was something there, and they had been using it, and physicians knew it as well. That was the lone voice. But today, really nothing is taught to us about the endocannabinoid systems. I learned nothing of that in medical school. And, I became an MD at age 26, and I know it's going back 10 years now. And so you figure that, I still haven't learned anything. Anyway, so this is my experience through this whole sort of thing, and as I say, it's an exciting time. I think we're on the very edge of this cannabopathic medicine that is becoming more and more real. I look at all the different things that indications that you have on board there, and they are so true, many of them, and have looked at them in use in other patients. We talk about anxiety, and I love the phrase that it's a neurological laxative that acts to surface the anxiety that's held within. I think it's just a great description. And all the other things that we can use it for, from irritable bowel syndromes to fibromyalgia to Parkinson's disease and chronic neurodegenerative diseases, et cetera, and it's fascinating. But I'm going to throw away all this physiology you've been through, all that, thank goodness for me. Why is it that doctors have been resistant? I'm going to tell you these points, and I think it's important because I think it's something we can all do about it here. And by the way, let's not make this a monologue. If you feel like interjecting and going ahead and discussing something, just put up your hand, left hand or something. Go to the washroom, right hand. Your question to the washroom is both. But anyways, in May of this past year, 2013, the New England Journal had a poll of physicians in North America. So it's a worldwide poll. But they put the scenario of Marilyn, a 68-year-old woman with metastatic breast cancer, and the question was, MDs were asked whether she should be prescribed marijuana to help alleviate her symptoms. And they were actually, New England Journal, surprised by the outcome of the polling. Basically, 76% of all votes were in favor of the use of marijuana for medical purposes. Each state and every province had more than 50% positive responses in support of medical cannabis, except for one state. Which one? No. No.
California.
No. Boy, you're just tagging these poor states.
California.
No, and here's the interesting thing. This one state that was set aside, that was less than 50%. Do you know what the percentage was? 1%. 99% were against it. Utah. Yeah. And I looked at that and my head just spun, and I contacted all my friends who still talk to me in Utah and said, what is this about? Is it just the science is different in Utah? Whereas in Pennsylvania it was 96% positive. And I began to realize there's a tremendous bias, a conservative bias that exists amongst physicians and amongst people who it's this hard time losing that reefer madness syndrome that has been instilled deep in our brains. So that's one of the reasons. Another one is lack of studies. We talked about it. You talked about the lack of studies. And my thought is that, if you really want to find out, you're basically, a click away on a mouse from reading some of the 10,000 studies, biologically active studies of the cannabis sativa plant. Now, they may not be the double-blind randomized studies that we look for, but why? I mean, this has to be fun. I do a lot of studies. I'm doing studies involved in all sorts of things. But they're all financed by, again, big pharma. And so they're not crazy about studying a plant, even though it's the most studied plant in history. And so I say to my patients, when they come in and they have a condition, I say, what I want you to do is I want you to Google your condition and marijuana. Google acne and marijuana, or your swollen uvula and marijuana. And you come back and tell me what you think. because there's a lot of information out there. And I can give you some feedback as far as that works. So the lack of studies is something that doctors will quote. And in fact, and when I say doctors, I'm also talking about people in Canada, the BCMA, College of Physicians and Surgeons. Third thing, as you mentioned, this is doctors have a bit of an aversion to say, smoke 2 of these and call me in the morning. It just is not something we're used to writing down. But fourth is the image. And when I say this, the culture sometimes has become a barrier to many physicians, a conservative group, if I say anything. I mean, it's hard to say, I would like you to go and grab some super silver haze and some Alaskan thunderfuck. And I think that's what I was saying. We don't say that routinely. It doesn't come out very well, especially when you're raised a Mormon. I have a hard time saying that now. But, you know, and wash it down with a little Baba Kush. I mean, it's something that is, by the way, that Alaskan thing, I think is an apt description of how this MMPR program is going to be rolled out. That's exactly how I think it's going to be. I think that they need to have more, you know, as physicians, we need more clinical sounding name. I'm thinking, you know, Weedocillin or something like that. Like that's our interest. But we've had some bizarre names in the past in the world of medicine for names of medications. We actually have one that was called Urispaz. That's the name of the drug, Urispaz. That's the one, that's exactly right. There's one called NoCal. There's one called Cripplex. I'd say take some Cripplex. A little side effect, you know, not walk right. Widocillin. If your wife came home with a bottle of Widocillin for you from the doctors. And there's even a genetics company in Italy that decided they changed their name after they were told that Gen Italia was not going to work out well. And that's absolutely true here. So names are everything, appearances are everything. In case the point is, I'll come back to this actually, but the fifth thing, I think you brought this up earlier, is the consistency in dosage. We're used to consistency, we're used to dosage, being able to write such and such milligrams, and we want to, we as doctors may not come out right, want to give you the dose, but we want to give you the correct dose, so to speak. And so we want to be able to titrate and customize and be able to do the things that you've shown here, but we don't have that information. And so it's sometimes, not because we don't want to, but the MMPR program will make this even harder to do. Because there's just no great catalog for us to turn to and say, hey, this is what you should be on. This is the dose you should be on. And so doctors are having a hard time with this. Another thing is scammers. Now, I used to be a trusting sort of doctor and believe that when everybody came in and talked about something, that was true, that they had that thing. I have now become more cynical, so that when someone comes in and says, my knee is sore, I say, you lying pill-popping skunk. You're after drugs, aren't you? No, I'm not. You know, honestly. But I've become that skeptical of people because they come in and they try all sorts of things to get the narcotics, to get the benzos, to get the sleeping pills, to get the medications that they don't need. They will, for example, have the old broken collarbone, which they say is new. They will have old scars, which they say are causing them agony. They will go into the washroom and they will prick their thumb and put a little bit of blood in the urine and say they have a kidney stone that's causing them agony. They try all the tricks. We have to deal with this on a daily basis. And we do deal with it. And so we become cynical. So I don't think you do favors if you're a recreational cannabis user going in requesting medical cannabis. Because it begins to paint the whole picture that maybe people are just after, sort of a legal angle to have cannabis. So we're wary of that. Physicians are naturally wary of the scammers. There's the thought of a gateway drug. Well, we know it's the opposite. I now see patients, and many of us have this, who used to taking narcotics and benzos and are no longer taking these. So it's the anti-gateway drug. It's a gateway away from narcotics. And we see patients doing this all the time. Fear and lazing of the unknown, number 8. I think doctors have been afraid about litigation. They've been afraid about learning something new, and for some it's just easy to say, I've been doing the same thing for years, I'm going to continue doing it, I don't understand this. And I say, they continue on as sheep until they're told by their association to do otherwise. I hate to be that nasty, but I know physicians who are like that. It's just easy to take the easy route, and they're really not overly concerned about learning the new things that are necessary, not that this is new. And finally, side effects. Again, everything we do in medicine is about risk-benefit ratios. We try to assess the situation, determine whether the risk of medication, the risk of something versus the benefit is, what the ratio is, decide based on this. So there's always the concerned side effects of cannabis that are typified by the stoner, and they start thinking about driving side effects and things like this. Yet, the Canadian Medical Association Journal reported that opiate-related deaths have doubled between 1991 and 2004. Okay, so we prescribe lots of things with horrific side effects to them. And again, it's I find that worry about the side effects of something that's ever been shown to cause a single death, when we prescribe things that are so tremendously deadly, potentially deadly, is, I think, hypocritical. As Sanjay Gupta said, I love what he says, and this is one of the reasons I think I admire him for helping the Turning Point turn. He says, we have been terribly and systematically misled for nearly 70 years, and I apologize for my own role in that. And I love that he apologizes on behalf of whoever he's apologizing on behalf of. Specifically, he admitted to being too dismissive of the loud chorus of legitimate patients whose symptoms improve on cannabis. He said, I had a very uncomfortable discovery that I had been brainwashed, just like about every other citizen in this country. Marijuana is not a toxic drug. It's remarkably non-toxic. That's quoting him in what he's written. So, I think that that's been part of often how we feel. And so, talk is cheap. And I want to put out a couple challenges to you. Because I remember when my daughter graduated UVIC here, the valedictorian saying, you know what, go out and get a cause. Get a good cause, a selfless cause of them, and get behind it. I think that this is a good time to be involved in a cause like this, not to walk away here just loaded with info, but walk away here loaded with perhaps a desire to do something about it. I'd like you to know, number one, to pressure the government a little bit to start financing and improving cannabis-related studies. Maybe it's a field that interests you. Maybe it's something like arthritis or something that you or a friend have, or a family member. But be specific and be informed, which I think you are really well informed if you've been here today, listening to Dr. McKinney's and other talks. Number two, get your parents, no, I thought I was talking to you, Vic, here, and grandparents, because chances are many of them have lived through the summer of love, and that cannabis has helped them do that, do it, more ways than one. But they're the ones with the illnesses. So encourage them, because I have patients coming in who've been encouraged by their families to explore the use of medical cannabis and provide them with the information of that. So maybe talk to them to do this. Number three, when the opportunity presents itself, pressure doctors. Go in and say to the doctor, listen, I really don't want to take an opiate or benzo or sleeping pill, but I've tried medical cannabis. Again, if it's for recreational purposes, that's not a good idea. Number four, to stop stereotyping cannabis as a stoner and making our job so much more difficult. The problem is not cannabis, never has, never was, to Nixon, for example. The problem was what? The users, the cannabis users, and how he went after them, and same with Anslinger. To be honest with you, sometimes the stigmatizing gets in the way of the legalizing. And I think that legitimizing, and especially in the face of doctors, so that it needs to be, as I say, when Prop 215 of California, Proposition 215 of California was put forward, George Soros, the billionaire, and others put millions of dollars into changing the image of the medical marijuana individual as not being just a pothead. But he changed this specifically from the smelly sort of, as he said, nobody takes hippies seriously, but they're great and fun, but it's hard to take seriously. But he changed the image into a decent alien Californian who took it not to get high, but to get help. And that was the image that allowed Prop 215 to pass in California. So it needs to be legitimized. I would say do not be given to flippant superlatives. All right, when things are not proven, then I think it just, becomes a problem when you start saying things that are not necessarily proven. I mean, anecdotes are wonderful, and I think that you should go with them. But to rest your laurels on them is not a good idea. As I mentioned, don't apply for medical cannabis because you're a recreational user. That is the biggest problem we have as physicians. As recreational users coming in, I have now a reputation in town. People come to me all the time, wanting me to authorize, legitimize them to have medical cannabis. And I have to go through with them, and I would say well over half are not legitimate. They just want an excuse to be able to use recreational cannabis, and this is fine. But I can't, and other doctors will have a hard time with that, if that takes over. So encourage the authentic use of the system, and doctors will continue to, as I say, the tipping point is happening. I was very impressed with, when I gave this lecture to physicians this week, with the willingness to understand more. I guess they see that Health Canada's changed, they know that they better play a role in this. Now, it's frankly irresponsible for us to continue to ignore the science of cannabis and to listen to the patients who have no interest in getting high. When 75-year-olds come into our office and have more knowledge about the endocannabinoid system than I do, and I say, shame on me. Shame on us as physicians. When they come in, we should be willing to help them deal with their colitis, with their anxiety, with their pain, with their seizures, with their concussions now, with other things. And these are people who've never jaywalked before. We can no longer, I think, be satisfied, I know as physicians, to be ignorant. I think that's irresponsible. And it's my hope and challenge that here in this room and elsewhere, to continue to put the foot on the gas at this time, at this tipping point time, to learn and to lead and not let the mistakes of the past progress to become the future. Thanks very much.
I was just noticing when I've been on the internet and I've been networking a lot on there, that there is a doctor's site which is to teach them about the diagnosis for what's appropriate for patients, some of the possible dosages, monitoring, conferring, and symposiums at the, it's called the Canadian Consortium for the Investigation of Cannabinoids, so that's Dr. Mark Ware's site, and it's at, in case anybody wants to write it down, it's www.ccIC.net.
Which I belong to, as well as belong to SEC, Society of Clinical Cannabis Clinicians. And I agree. I think that this is relatively new things for the MDs, and we need to get that in front of them. So sure, I mean, Dave Hutchinson sends me stuff all the time, and I do read. And it is remarkable to see how things, but this is really an evolving thing right now. And I think that doctors can be lazy, they're busy. They don't have time to learn all these things. So yeah, when you can, somebody like you came into my office and said, you know what, I'd like to, this is something that I think, given what's happening in society right now, you might be interested in. And I would look at it. And I think a lot of doctors will. So I agree. That's an excellent point, is to make them more. Yes?
You said you lectured or spoke to a number of physicians in town. What is your thinking on the position of the college right now in BC? Because it seems as though the college in Quebec seems to be quite pro, actually. They're moving in a very positive sense, so we're hearing from Mark Ware and others. What is your sense about British Columbia?
I think it's good we're not Alberta.
Well, certainly we don't have to slam the door on Alberta. I mean,
no, I think it is one of caution. I have the statement here by the registrar. It is one of caution because of studies, lack of studies. They really, I think they just take the Health Canada line and they just regurgitate it. And I'm thinking, unfortunately, it is, I think, somewhat, you say the word cowardly, but it's, I think some have thought it through. But I've actually put a call out to the college with a list of questions that I have, and I'm waiting to hear back from them this next week. It's just the person who's going to respond is away. And I think that, again, this is a work in progress. the statements that they make now may be different than the statements made next year.
Oh, clearly, but it's just.
And continue to
I
progress.
think physicians like yourself, I mean, you spent a great deal of your life and you're very dedicated to your profession. My doctor, I go to him and he, as I said before, show me the science.
Yeah.
He's saying, show me the science. He's saying, I'm not closed-minded to it, but I'm being told by the college, stop. I mean.
But when people say, show me the studies, we need more studies, what they're really saying is we need more procrastination. We're not willing to sit around, we're not, go to your computer, click on it, go watch Sanjay Gupta. I mean, seriously, it made little things like that. I mean, when I did this before that Sanjay Gupta second show came out, and I think probably 70% of them went home and watched that, and came back the next day and talked to me about it. And they were impressed. They just don't know. It's just, they just don't know. And so it's easy for them to say, I'm just going to kind of do what the college says to do, but I think that that's irresponsible when it comes to your patients, who will tell you that these things work. You're not going to hurt them. So I think you have to make that more and more. And just by these little sound bites and things that you can leave with your physicians, I think it's important. Like the references do. Yes?
Even though the anti-marijuana rhetoric was much more vehement in the U.S. than it was in Canada, it seems like the AMA has been a little bit more responsive than the CMA. Can you suggest why that would be?
Well, it's interesting. You talk about our local college in BC. They're actually referring to let's go see what happens, they say, in south of the border. That's actually a statement that they use here, because they want to see what is going on south of the border, because, and we're BC. It's like swung a little bit the other direction, hasn't it? Canada was the first country in the world to legalize sativas, I believe, is that right? To use sativas. And it drives the Brits nuts, because they were the ones who developed it. In Canada, led the world with this. So we're sort of falling backwards a little bit, I think, when it comes to that. And we see sort of the states here. But the quote from the registrar, basically, blah, 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 absence of scientific evidence, so forth and so on. But Canada could follow, this is the quote from the registrar of the college. Canada could follow the lead of those jurisdictions in the United States that recently decriminalized the use of marijuana, recognizing that trying to regulate it for medical purposes simply isn't feasible. Either way, physicians should not be forced to address the social implications of the new access regulations and make decisions that are contrary to their ethical obligations and blah, blah, blah nonsense. So that's the response. You're absolutely correct. I think we're behind. And I think that knowledge is power. And so any influence that I have as a physician, from things I learned, I'm going to use that to, again, bring it to the fore when I can.
So I'm wondering, how much of this reluctance with physicians might be fear as well as lack of knowledge. Now, I had cancer 2 years ago. I went to my GP and said I was going to do cannabis. He didn't want to hear anything about it. He literally went la 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 la. And once I went back to him cancer-free, now he's totally endorsing. So Corey, cannabinoids are amazing. Do you know how many people we kill each day with pharmaceuticals? There's sort of that thing of having to see some proof on the table.
Well, and I think Dave Hutchinson can tell you the stories about the people he's run into in his thing with the medical world. But, this is how physicians see me now. And I mean, they know I'm a right-wing, Republican conservative, but they see me like this. This is how they think I've gone right off the deep end. They want to send me back to Jamaica. I went there a couple of years ago, and I went up to, now Jamaica, you can get by in Jamaica, much like my hockey team, with just 3 words. No, prob, and lamb. That's it. You can get by with those 3 words and, oh great, this is going to show up in the Times columns. Thanks for that. I'm just going to say that, But this is how a lot of my colleagues see me now, is that they see, going, well, the fact is, I never smoked that. I've never taken it. So, which maybe makes what I say sometimes a little more credible. I'm not sure. Maybe gives it more cachet. But when I was in Jamaica, I went up to 9 Mile, and on the way up, as I say, no problem, lamb are the 3 words, and if you're given to be running off the mouth, you might add a yaman in there. But other than that, we drove up to 9 Mile, which was a couple hours. And these little things sort of bring home to me that sometimes, having lived in the jungles of Vanuatu, where I wonder sometimes who is more civilized, nations like that or nations like ours, where I come back, I had more culture shock coming back to Canada than I ever did having gone to the jungle, where I anticipated what I was going to have to see. And watching people do this, and things that I'm just so unaccustomed to for almost a year, it struck me as how extremely decadent and odd that we really do live in our society. I don't know how I got into this. I can get this thing on. There I go, Bob Marley. It's rubbing off on me. But the answer is yes, whatever your question was.
Thanks, Dr. Hepburn. I'm going to get all of our speakers to come down for a photo op. That's one of the things I like to do towards the end. So I will remind everybody that we're having a raffle to try to pay for stuff. We got some art and a couple of pipes and vaporizer there. We're doing the raffle at 420, just over here a little bit. Thank you so very much, everybody, for coming. It's been a wonderful day. Thanks again to all of our guest speakers. It's been a very informative afternoon. Have a wonderful day, everyone. Thanks for coming out.
Thank you.
Here, come on, guys.
Oh, no worries. All right, all right.